Now with the GMA Health Alert on prostate cancer, a new report out from the American Cancer Society showing cases are on the rise again for the first time in years, with striking racial disparities at play. Our medical correspondent, Dr. Darien Sutton, is here to break it all down for us. Dr. Darien, it's always great to see you.
Great to see you all.
So break down the findings of this new report for us.
Yeah, so these are some concerning numbers, Whit. So overall, the rate of prostate cancer has been rising, and most concerning, patients and men are presenting later in their diagnosis and with more aggressive diagnosis. So this is looking at the numbers. Since 2014, we've seen a 3% rise every year in the rate and the number of cases of prostate cancer, and comparing that to before 2014, where there was a decline of 6% per year. So what happened in 2014? Right before that, in 2011, 2012, the recommendations that are provided by the United States Preventative Services Task Force, that's what we as doctors use to recommend for patients, had recommended against routine screening because the concern at that time was overdiagnosis and unnecessary treatment. But obviously, we see where we've gotten today. Disparities have also worsened. For black men, 60%, more than 60% more likely to get a diagnosis of prostate cancer, and more than twice as likely to die from the diagnosis. So important to understand the risk here and to understand the benefit of screening.
Let's stick with screenings. When should most men go out and get their screenings?
Yeah, so there's a lot of different ages that we talk about in terms of your risk. I recommend, number one, having the first conversation at the age of 40, regardless of your history. But some specific details here. The average risk person typically starts screening at the age of 50. For those who are high risk, for example, if you have a father, a brother, or a child that has been diagnosed with prostate cancer for one reason or another, or if you yourself have been diagnosed with prostate cancer before for reasons for other reasons, or if you have a very high risk. For the age over 70, this can get confusing. It's not generally recommended, and the reason behind that is because prostate cancer is often slow growing. So the thought is that you will likely continue your life with it without complications. But then again, conversations are important because everyone's risk is different.
And beyond screenings, what can men do to lower their risk?
Yeah, so number one, you want to make sure to know your risk and know your family history. I think that's so important. And there are some basic things that you can control. You can't control the genetic part, but you can control your lifestyle. For example, decreasing the amount of processed meat and red meat in your diet, making sure that you maintain a healthy weight. We know that excess weight is associated with a more aggressive diagnosis, staying active, and then, of course, avoiding smoking and abstaining from alcohol if you can, especially if you're at higher risk.
Important information. We're seeing new types of screening as well, too, to make it easier for people.
Yeah, the basic screening is a PSA or a blood test, but there might be different options depending on your risk, so it's important to have that conversation.
Dr. Darien, as always.
Of course.